Good morning and welcome back. Again, thanks everybody who came back for the second day, and also thank you for a terrific first day. I personally found it incredibly helpful, particularly since I work in this space. So I really want to thank everybody for the hard work they did yesterday. So without further ado, we're going to ask our guru here to come on up and kind of share his reflections on what happened yesterday. Malcolm?
Thank you, Eric. I guess as you get older, you get called, if you're lucky, a guru. I'm not sure what that means. So don't expect anything guru-ish. But I did have an early dinner last night and restricted myself to only 2 glasses of wine because I had to get back to the hotel and think, which was wonderful. I had a couple of hours to think. So there was such a tumult of activity yesterday. I was saying to Neil and Eric that ideas kept popping into my head, and I asked too many questions, and I should have reserved those probably for this period now. But in any event, I have 2 slides with some bullets on that I looked for repetitive stuff, not just stuff that struck me as important, but stuff that kept coming up, usually in different guises. So I tried to distill it down to 10 pithy points. You know, one of my favorite movies is Mel Brooks's History of the World Part 1, where Moses comes out with 2 tablets with 10 commandments on each, drops one and says, well, here are the 20 10 commandments. So that's why they're 10. Also because it was getting to be midnight and I'd had enough. So this doesn't necessarily follow the sequence of the very productive and really very robust discussion yesterday, for which the speakers are partly responsible, the organizers are partly responsible, but really the attendees, you all, are mainly responsible. So I wanted to thank you for that in case I don't have a chance later. Vision is almost everything. If you don't know where you're going, some wags have said, any road will get you there. And actually a number of interesting people have said that. Alice in Wonderland is where the original quote is from. But the Beatles, in Any Road, not Abbey Road, Any Road, which is a song they put together, that George Harrison actually wrote, says the same thing in the refrain repeatedly. And of course, the great Yogi Berra, who died just earlier this year, or was it last year? But recently, said the same thing in his own inimitable way. But it really is important. If you don't know where you're going, then the discussions you have are largely sterile. And the operational side of things, which Eric and others have emphasized as important, beyond just the strategic thinking in these matters, doesn't get you there. And so this term social accountability, which I'll leave for you to define, but I think in the terms of what we were talking about yesterday, we really need to frame the discussion in terms of health or wellness, probably even better, or well-being is the more common term, rather than health care, with the emphasis on care. And that came up repeatedly, and I think it's really critical. The second point that came up, I think, repeatedly was the need to align clinical accreditation, and I should have put that in quotes, but I think you know what I mean. That is accreditation of the delivery sort of side of things, which is clinical, and educational accreditation, of which we have many experts here, far more expert than I, is critical. And it was described in one of the small groups yesterday by Karen Sanders as 2 non-intersecting circles. And David Benton took a little bit different perspective and said, well, it's 2 separate things, but they're overlapping. And the sparks and new things can come from that overlap of the 2 components of the Venn diagram. And the bridge that David and others kept returning to, the glue that held the 2 circles together, was really another social accountability issue, which is patient-centered care. You can call that community-centered care, you can call it population health, but those socially accountable issues, starting with the individual patient and ending with the population at risk, so to speak, came up in a multitude of different ways, perhaps far better than what I've summarized here. Susan Phillips opened the meeting with a conceptual model of accreditation. And I think models are important. They're generative. They generate ideas. They generate thoughts. And I'll say no more about her model, but I would suggest you take it with you and reflect on it and think about it and use it, steal it unashamedly from her. Because I think it's sort of important where that circle sits within the arrow. And of course, all those arrows which are mixed within the regulatory framework or square that she did. So she did a far better job than I can, but I think it was very helpful to start out with that. So I think the organizers were smart in bringing her in to give a brief sort of overview so we knew what the terrain looked like. One of the most important things I think Susan Phillips said is the next bullet, but you've all said this in your own ways, that collaboration is critical and that they diminish tensions and if put together productively will drive change. Now that's a strategic statement. It doesn't tell you operationally how to drive change. But one of the factors that can be used strategically, and I think tactically and down to the operational level, is team-based care and IPE can be used to leverage change. And when you're thinking about this IPE thing, which we keep coming back to, we sort of started the forum with it. We've tried to get away from it because there are other important things, but we keep returning to it. And there's some meaning, I think, to that repetitive look-see at team-based care and IPE is one of the vehicles, or two of the vehicles, depending on how you look at that can be used to leverage change and is important. In thinking about that, however, we tend to think about it at the early part of the learning continuum, which is where most of it occurs at the moment, right? Why does it occur at the foundational educational stages? Because we've got those kids captured and it's easy to do. We own them. Whereas who owns the graduate level stuff? Much more complicated. And who owns the continuing professional development, which makes up 90% of one's career anyway? Now, there are associations and organizations that, in a sense, shepherd that along. It's not that there's no attention to it. But I think there's much less attention to it on the right-hand side of the continuum, so to speak, than there could be or should be. So those are the first five. See if I can get a... Oh, this one's going to be very fancy and do them one at a time. So everyone said, and I think could agree, that change is necessary, whether it's transformative change. Oh, I'm always wandering from the mic. Oh, I can see it here. You see that? They're very clever. They're very clever. It comes up here too. I don't have to look there. So the need for change is ubiquitous. We've all talked about it. I mean, in your own ways, in your own environments, in your own silos, because despite us trying to get out of silos, we spend 99.9% of our time in them. But it seems to me that you've said that and the speakers and commenters have said that the need for change is ubiquitous, but implementation strategies are scarce. They're not absent. I mean, people are beginning to try and deal with that, but that's really the heavy load. That's the heavy lifting. So one of the comments was the what is clear, the how is much less so. So this issue of how you get at the how to do these change initiatives, I think is something that the forum and other organizations are going to have to spend a lot more time thinking about in the future. You know, the need for enhanced outcome measurement, was much in demand, along with validated toolkits, et cetera, all the stuff that you measurers, and I'm not one of those people, know far better than I, but it kept coming up. And this very interesting point that when you think about outcomes, there's a hierarchy, or there's a sequence of outcomes from the proximal, which are largely learning outcomes in the work that we all do. But it's the distal outcomes for which the learning is necessary. The learning is an early outcome, or maybe in advanced Kirkpatrick sort of models, there's some learning that's intermediate to the need for collaboration and true team-based behavior change. But the linkage in that chain of outcomes to individual and population needs, which are the distal or terminal outcomes. I don't like the word terminal for obvious reasons, but the distal outcomes, the end of the chain, so to speak, really should take precedence over the proximal outcomes. So I think I urge you to work on that end of the chain as hard as it is, and neglect to a certain degree, not completely, but de-emphasize all the work that's on the early or proximal outcomes. This is terribly important. The whole issue of context kept coming up and up and up again. And what we tend to do is our little pilot projects and our demo projects, and well, this worked at the University of IHPE, so it must work everywhere. It rarely does, so that people keep producing these blueprints, which are then muddied by context. So that this issue of sustainability and generalizability is sort of critical concepts that we need to think about much more. So it's not that blueprints and the pilot work that you're all doing is not important, it is. But don't forget the context, because it will completely bedevil you, particularly clashing cultures, which is part, not the only part, but an insignificant part of the contextual issues that we have to deal with. Now, I could have said more money is essential, but I urge you to get away from that thinking. Yes, if you can get more money, an absolute increase, great, but it really is a zero-sum game, at least in rich countries. Now, in less developed countries, it's a different issue, I think, but even there, the pie is fixed. And so I would think that a lot of the policy work that's necessary, and a lot of that is the operational heavy lifting that's needed around policy as well as measurement, but that needs to be framed as, where can we take money from? Where can we rob Peter to pay Paul? I mean, I was astounded by some of Harrison Spencer's slides yesterday, I guess it was. No, it was at the planning meeting, wasn't it? It was at the planning meeting, so not all of you were there, but many of you were. And when you look at where all the money is going, this huge big bar, and then all the decreases in budgets, and this was looking at the United States budgets largely, national budgets, but not to take money from health professional education, from healthcare delivery, that big positive bucket, and put it into early childhood education, just as one example. I mean, we've got to look at the context of things and not just at our own funding. So be very careful when you're thinking policy issues, because politicians, by and large, are running out of money, at least in this country and probably globally. I just don't know enough about that. So redistribution is the game. And then I got to 9 and I thought, and what's the 10th? And it occurred to me that everyone had spoken about leadership. And I just wanted to reflect with you for a minute that the main task of leadership is to manage uncertainty and foster collaboration. That's what you want in your leaders, I think, more than anything else. And so pick them wisely, because we keep picking them unwisely. And that's not because they're bad people. And it's certainly not because they're evil people. It's largely because they don't have the skill set that's necessary to do those two things. And that's a hard skill set to find, managing uncertainty and fostering collaboration. So I'm not sure that came up yesterday, but leadership kept coming up, and so I think it's important. Now, a picture is worth 1,000 words, so I brought 3 slides of cartoonish, no, not cartoons, but, you know, diagrams. This one needs no further description, right? It's the vision. It's really there about well-being more than anything else. So keep that in mind. This one is a little more complicated. It's my eyeball slide. Patricia knows this. I show it everywhere. I don't know, because it's just hard to make a lot of slides, so I only have a few. But just to give you an idea of how complicated building this eyeball is, these are the clinical microsystems in blue. Those clinical microsystems are embedded in the institutional and organizational meso or intermediate system. And of course, all of that's in the macro healthcare and education and blah, blah system. So it's an eyeball, right? Where's Susan Day? Are you here? That's an eyeball, Susan, right? It's an eyeball. Well, you're the expert. You're the expert on eyeballs. And so let me just put in here what I think David Benton described, so get rid of those, as the patient being the bridge. He described it as a bridge between all this, the patient-centered care piece that he talked about in the session that I was able to attend yesterday, the small group session. So the patient's at the center of it. Caring for the patient and caring about the patient is clearly a major element. But the more caring you do, the more learning that occurs in the clinical environment that improves one's skill set. And of course, the more you learn, the better you care. So it's a sort of feedback loop with the patient or the community, however you want to frame this, in the center. That's embedded in the meso systems, which are redesigning their clinical practices, and the educators who are working on educational reform. They rarely talk to one another. And we need much more roundtable discussion about those two people because they're linked through the blue stuff, the clinical microsystems. But they rarely talk to one another. And trying to be a reformer without being a clinical practice redesigner, or at least involving them, and vice versa, is a very sterile enterprise. And it occurred to me that a lot of the barriers we talked about were related to the lack of communication between those two things. And of course, the whole thing sits in the structure and financing of the macro system. So I think the important point here is the linkage between education and clinical here through the patient or the collective patients, that is the community. And the last one I wanted to show you just a piece of. I don't want to show you the whole slide. This is from the IHPE report. And what I wanted to emphasize here is that whatever you're working on needs to take into account the entire continuum, which is how the consensus committee defined it. And with IPE as the vehicle, the importance of the continuing professional piece. And I won't go into the outcomes and all the confusing factors that are the rest of the slide. I'll stop right here. But I think it's just useful to emphasize that if you're going to use IPE, or interprofessional anything, as a vehicle for change, you've got to think about that last circle to the right and not just focus on the last circle, on the beginning circle, which is the foundational education. So those are the thoughts that I had, most of which came from you all, and I thank you for them. And I tried to advertise a few of my own and other slides because why not? So thank you very much, and I'm looking forward to a good day today and safe travels home.
Great. Thanks, Malcolm. So thank you, Malcolm, for getting us off to a nice start and for those reflections. Our next session is going to explore the role of patients, families, communities, and populations in health professions educational accreditation. And to help moderate this session, I'd like to introduce Dr. Joanne Regan. She is the Vice President of the Education of Education at the Council on Social Work Education. CSWE is the National Association representing over 750 accredited social work programs. And just a plea today, and I want to thank Maria for this, if you use acronyms, make sure to describe them. Okay. I was in the Navy. My whole world was acronyms. Oh, by the way, Navy stands for Never Again Volunteer Yourself, just so you know. All right, so with that, I'll invite Joanne and her speaker.
Thanks, Eric. Good morning. Can Can everybody hear me okay?